Fillers in Your Face Part 4. So since we shared our video a month ago, it's gone viral and people have taken that video and come up with their own conclusions about some things, and I feel like I owe it to you to dig in a little bit deeper. First of all, as I mentioned before, you don't need to panic if you've had fillers before. Your face is not all of a sudden gonna double in size. Let me introduce you Alice Hart-Davis. She's a beauty journalist that I met last year, who actually is one of the first people who self-documented her journey with fillers. So her story is this: up to 2018, she had a few fillers injected over the years, and all of a sudden she decides to get more fillers. So the injector at that time injects about 10 cc's of filler all around the temples, mid-face, everywhere. And she was very happy with it. As you can see, she doesn't look overfilled. So she waits 3 years and says, okay, the fillers are probably gone, and decides to get an MRI. I want to give credit to Dr. Simon Morley for his pioneer work on 3D imaging of these fillers.
We can just delineate in the face exactly where the filler is sitting, so that just shows the main distribution of the filler.
The imaging that you see by Dr. Morley shows fillers present 3 years later all around the temple, the mid-face, everywhere. And the fillers are placed into correct tissue planes. When Dr. Morley did volumetric analysis, it showed that she had about 35 cc's of filler, which is more than twice the amount of filler she had injected. And again, this is not surprising because we know these fillers are hydrophilic. They love water and they do expand. But Alice doesn't look overfilled, so that's really important. So there are people around who have had fillers and they look completely normal, and there is no issues with that. However, problems do happen. Problems happen when people over-inject or have the wrong patient selection, or inject into the wrong tissue plane, or try to treat every little imperfection with these fillers. The biggest problem I have with our industry is this lack of standardized training. So this has led to this cascade event of lots of issues that we see around the world. The good news is that we can dissolve these fillers safely, and I will do a whole separate video on that. I hope this helps, this clarifies some things. If you have some questions, please leave us a comment below. Thank you.